again, Dr. Odette Suter here. This is part two of my story that I wanted to share with you. And thanks again so much for all the feedback from from the first part. I really enjoyed hearing from you guys, and I'm glad that it is helpful to you because I know a lot of people are in the same boat on some level or another. And so I'm glad that my story is helping you on your journey. I get asked frequently if I work on humans as well. Unfortunately, I don't, but this is probably the closest I can come to help you with your own health. Before we dive into the 6 pillars, I would like to allocate this part of my story to a few important points you need to know. One of those is the differentiation between chronic and acute disease, or chronic diseases and infectious diseases, because they require different systems to heal. The chronic disease is something that cannot be addressed with the traditional system that we currently have, because the traditional system does not have anything to help with chronic diseases much except for relieving some symptoms. But for the most part, for example, with autoimmune diseases or cancers, it tends to make things worse. It makes the body more sick in order to kill or suppress something. So for example, with autoimmune diseases, we tend to use immunosuppressant drugs. But these immunosuppressant drugs can cause all sorts of other issues. And some of these immunosuppressant drugs are actually chemotherapeutic agents that could also be used for cancer therapy. So with chronic diseases, it's very different. We have to address the body in a very different way, because it's not like the house is on fire, for example. Because when the house is on fire, we have the firemen come in right away in order to extinguish the fire so that we can save the house. So with acute diseases, with infectious diseases, that may be similar. We want to get rid of the bug or whatever is causing the acute disease and get rid of it and take care of it. Or for example, if I were to break my leg, or your dog would swallow the piece of rubber that needs to come out and is stuck in the GI tract, you definitely want the surgeons, you want somebody to fix it right away so that it can be functioning again and can restore itself. So same with the house, you want to extinguish the fire so that you can fix it after. But those are really acute things, emergency types of situations, which the traditional system is excellent with that. It has the surgery capacities, it has drugs for pain, it has all kinds of things to help with any sort of acute emergency type of situation. But with chronic fatigue, like I mentioned, most people with any sort of chronic issues, fibromyalgia, whatever it may be, they're just being labeled as, having some psychological issues, for example. And I see that with dogs and horses and other animals as well. If they don't move quite the way they should, or they're so-called lazy, we say, well, that's just how they are, or they're just crazy, or whatever the label may be that we put on them. But and again, anytime there's something wrong and an animal or a person is not behaving the way they should, in a healthy way, it means that there's something off. Obviously, we all have an off day here and there. That's just part of life, and we're never all happy and cheery. Because, well, that's life too. It has ups and downs, and it's a learning process and evolutionary process. But in any case, if something is wrong, on a continuous basis, just like it was for me with my chronic fatigue issues, then definitely there is something wrong and something that needs to be addressed. And it is difficult to find someone who can help you with that, because for the most part, especially with chronic fatigue, what I found is that people didn't understand it. They thought that, well, I was just being lazy, and I should be able to get up. Even my sister, who came and helped me out with chores and cleaning and things like that, she said that she couldn't really understand me until she herself ended up with some chronic fatigue issues as well, and she then told me that, yeah, I had no idea what you were going through. So unless we've had some experience with certain issues and certain with pain or whatever it may be, it's really hard to relate. And so we need to find a little bit of extra compassion And I think that was one of the biggest learning parts for me, was to find compassion and more understanding, and be more willing to go dig around to find what the solution could be for any given situation, and also really listen to people when they tell me things about their animals, because they're always right. They don't make, you guys don't make things up. You're right, and we as veterinarians or doctors, we need to listen to you. So again, we need to understand that chronic diseases, which unfortunately is most of the diseases that we see nowadays, have to be addressed very differently than more the acute and infectious types of diseases. And just like the word chronic means like it's been going on for a long time, we can also not expect that things will change overnight. So for chronic diseases, there is no quick fix. It's a process of rebuilding and restoring the body so that it can function properly, so that all the cells get the nutrients that they need and have them available so that they can function optimally, and detoxifying the system, removing what is bothering the body so that the cells can function even better. Of course, for me, it took quite a long time, as I mentioned in the last video, around 10 years or so, for me to finally start to feel like I had a life again. And that was just because I had to put things together on my own. I didn't really have a whole lot of help. I didn't have a program that was putting all the pieces together. I was kind of looking at each of these little pieces individually and working on them rather than putting them all together. Obviously, in the end, it worked out. But nevertheless, there's a way of speeding things up by addressing all of the different systems. Maybe not necessarily all at the same time, but in a way that makes the process of recovery faster. And this is what I really bring to the table with your animals, is that I've had the experience of examining my life and my health step by step to learn all of the things that are needed to bring the pieces together and create a whole picture. So it's really a journey. And for me, the journey didn't stop with the chronic fatigue and recovering from it. No, I had an accident with a pony that I was trying to vaccinate, which I didn't really want to do in the first place. And that pony turned around and basically stepped on my shoulders and knocked me over. Now, at first I was fine, but over time there must have been some damage to one of my discs. And I ended up with a lot of pain shooting down my arms. It was nerve pain. It was excruciating. And that was a very good experience for me. As painful as it was, I really realized more at that time that it is necessary to also have drugs available and to treat the symptoms and not just the underlying cause. Because before that, I was still very much against drugs. I mean, I still would prefer not to use them, but I've put them in my toolbox too now. That said, I ended up with quite a severe reaction to one of the drugs I was taking for the pain because it was so bad. I can't remember, it was either Vicodin or Percocet or, one of those really strong painkillers. And I didn't really do well with them. First of all, they didn't really help with the pain quite as much as I wanted. But I also developed an autoimmune reaction to it. So I ended up having pain everywhere in the body. I had swollen tendons, sheaths here. I could barely move my arms. I couldn't even squeeze a sponge because I was in so much pain. Or if I wanted to shift gears, I had to use both hands to move the lever. So it was pretty bad. But because of all that I had learned with my chronic fatigue recovery process, I was able to actually recover from that much faster than I could have without having learned all the things that I learned before that. So I put all of the pieces together, and it only took about 2 years, which is still pretty long to really fully recover from that. But that was pretty fast because autoimmune diseases are challenging. Once the immune system is out of whack, it's hard to get it back into harmony. But I managed to do it, and I've been autoimmune disease free since then, and tested for it, and had a clean bill of health in that regard. So in any case, that's just to tell you that healing is not a quick fix. It's a journey. And you have to be patient, and you have to stick with it, and you have to continue with it. And unfortunately, it oftentimes takes a little bit of an investment as well. but what you'll gain from it by restoring the body is going to be much more than what you could imagine. So it's all good. So let's keep going on the journey. In the next video, I'm going to start diving into the 6 pillars, starting with diet, and give you a few of my little secrets that worked for me. And yeah, I'll see you then. Thanks for listening.